Hello, class. This is Leon Volosky presenting for HHP 247 in Professor Michelle's class, Team Sports. I'm going to be presenting about a hamstring strain injury, so let's get to it. What is a hamstring strain? It involves straining or pulling one of the hamstring muscles. There's a group of three muscles that run along the back of the thigh, and it is the result of a muscle stretching too far and eventually tearing. These occur in people who play sport that involves sprinting, sudden stops. As you can see, when somebody sprints, he is using these muscles right here, which is part of the hamstring muscles. And this is a diagram to show where does the hamstring strain occur. There's three muscles: the biceps femoris, the biggest, the semitendinosus muscle, and the semimembraniosus muscle. This is a knee, just to show, and this is the area. So this is usually where a muscle tear would happen, and usually, it tears right there, as you can see, when somebody maybe sprints or something. So what can cause a hamstring strain? It generally occurs as a result of muscle overload, such as when you are running and your leg is fully stretched out just before your foot strikes the ground. When your foot strikes the ground and all your weight is on it, the muscles can get stretched too far, and that's when they start to tear. It can be caused by not warming up your muscles before exercising. They're more likely to strain when they're tight. Also, when you're out of shape or overdoing it, your muscles can be weaker and cannot handle as much stress. Poor technique as well is a problem. If you don't have a good running technique, then sometimes you may be doing an exercise wrong and you can increase the stress on your muscles. Another thing is returning to activities too quickly after an injury. You need to heal your muscles properly and give them plenty of time to rest and heal. So that's very important. And when you don't do that, it might lead to an injury. And another minor thing, if you have an imbalance in the size of your leg muscles, your quads, which are at the front of your legs, most of the time they're bigger than your hamstring. And whenever you do something like running, they can get tired more quickly than the quads. So your hamstring can get more tired quicker than the quads, and this can lead to injury in some rare cases. So our patient is Tom. He's 21 years old, college student, and he plays intramural ultimate frisbee at his school. So he has had a hamstring strain before, and this means that in a sport like ultimate frisbee, it's very high chance of this possibly returning a hamstring strain. So whenever he had his game, whenever his injury occurred, he was late to his game and he missed a warm-up. This is a key sign. He missed a warm-up. His muscles weren't warm. He just came out of this wherever he was, and this is a big deal because when you have an injured hamstring muscle, then it can lead to it being injured again if you don't take proper precaution. And he didn't warm up. So after a couple minutes, Tom was sprinting past defenders. He goes to make the catch and doesn't make the catch because he comes down clutching the back of his left thigh, grimacing in pain. There was a trainer on site because this was a high-profile ultimate frisbee game. However, Tom was injured, so they assessed his pain level as 7 out of 10, and I believe that he suffered another hamstring strain. So we're going to work on getting him back in the field as soon as possible in our clinic and at Tom's home. As I said, he's 21 years old, college student who plays intramural ultimate frisbee. He reported a sharp pain of 7 out of 10 on the back of his left thigh, and he felt the pain right after he was going to make the catch. He couldn't stand up. He was laying on the ground. He had to have support from his teammates to walk. So he went directly after his injury to get treatment, which is perfectly reasonable of him to do. Here's this diagram again. So when we went to examine Tom, he had discoloration and bruising in the back of his thigh. Even though it just it happened recently, you can already tell that his injury is there, and you can also notice a deformity and defect in the muscle tissue. The patient is tended to palpitation over his biceps femoris muscle, which is the biggest muscle most likely to get injured, and his semitendinosus muscle. So that's this muscle. He did not, however, injure his semimembranosus muscle, which is good. He doesn't have a severe hamstring strain, just these two muscles, and it needs to be taken care of course. His active range of motion is with no limits on all plane, but when you start bending his knee, he starts feeling the pain, and when he starts feeling pain when bending his knee, which is his active range of motion is with no limits on all planes, but he has a 7 out of 10 pain when bending his knee. So this is another sign that one of the muscles helping him involved in this movement of bending his knee is injured. And his passive range of motion, it means when he's not moving, with no limits on all planes, but it is a 5 out of 10 when walking, standing up. So for him, it's hard to put support on his, it's hard to support his body on his leg since this muscle is injured. And the manual muscle test, as you bend the knee, the muscle is starting to become weaker, which is another sign of a hamstring injury. This is my SOAP plan. So we start with the assessment. We did the hamstring stretch test. As you can see, this is a very good diagram to show. And this is also called the straight leg raise, also called the Lesegue test. There's a lot of names for it. However, when you see this is about 45-degree angle where it splits at. And Tom got 40. So 40 is in the bad area. And this means that his hamstring is not performing to its best. Since he cannot raise it all the way up as an athlete, he should easily be in this area, but the pain is causing him to not be able to stretch it more. And there's also resisted knee flexion, which is when you push your knee up with resistance. And this was positive because it showed that he was having trouble with it because his hamstring was injured. If it's a very severe case and maybe he tore all of them, then you would have to do a slump test, but we did not perform. We found that this was satisfying enough to diagnose him with a hamstring strain. So this is our plan. When we took him in the first time, put an ice pack and elastic compression wrap that was applied for about 15 to 20 minutes with his leg elevated. He's told to continue using an ice pack and regularly stretch the muscle when he feels sore. Once it dies down, the rehab program will be started. So for the next 4 weeks at home, Tom will use the Rice method by resting, icing, and compressing, and elevating his leg in order to help it heal, die down the bruises, and then he can finally start some gentle hamstring stretches. So this will get the hamstring back in its original form, where then he can also start flexibility exercises to make sure that his hamstring is fully operational. And after this, we can begin strength exercises to build back some of the strength that he lost because of his injury. Now, depending on the severity, he may have needed surgery, but it wasn't that bad. He wasn't in excruciating pain. He just had to use crutches, which is perfectly reasonable to use crutches when you have a hamstring strain until you can walk comfortably again. After this program is over, we're going to keep in touch with him to know how he's doing, how his hamstring is healing, how he's doing with his sports, and so we're going to also show him how to prevent further injuries. So this is
Here are 3 exercises for a hamstring injury. The first exercise is called the extender. We'll extend our knee just before we start to feel pain and then slowly come back down.
So this stretch, as you can see, when he raises his leg, we're going to do it until he feels pain. And that's going to be the stretch that's going to start rehabilitating that hamstring. And another stretch is going to be...
And then we'll progress into a diver exercise, which looks just like this.
This is going to be a little bit harder for him to do. However, it stretches the hamstring a lot more, and it will be very good for his rehabilitation again.
And then finally into the glider, we'll slowly slide our back leg as far as we can go.
This is the last one. When you use the slider, you want to have something next to you to support, because at the beginning it's going to be very hard to do. And I recommend for Tom to do this exercise throughout maybe week 3, even, because it's going to rely a lot on his strength. The next flexibility exercises are going to be this right here, which is going to show the proper form on how to stretch his hamstring and unlock that full flexibility. So like he says, you want to keep your knees straight and bend with your back straight as well. This is going to be hard at first, like everything that he's going to do, because he is regaining strength in his muscles. So after an injury, it's very hard to do that. And this is another hamstring stretch that we're going to recommend him to do, which is with an elastic band, where he will stretch out his whole hamstring, where he can feel that stretch and then move it side to side, so that he can get that stretch, he can get that proper flexibility to make sure that he can move it all the way to the full extent that he can do it. So this is going to be really helpful for him. And as last, to give him some strength, to regain strength in his hamstrings, we're going to have these exercises right here, which instead of stretching, he's going to gain some strength back into his leg. So the first exercise that he's going to do is going to be this right here, a Romanian deadlift. This will help him strengthen his hamstrings, and this is going to be the proper form to get that stretch as well as gain that strength. He can start at a light weight and then increase his weight over time. The next one will be wide leg. So this will get another strength, and this will also cover the different muscles in his hamstring. And then, like I said, he's going to start lightly. And the last one, which is going to be the hardest one, is going to be this right here, just a single leg. This is going to work on individuality, and it's also going to help him to do that on the leg that he's feeling injured on. We're also going to send Tom off with a checklist to prevent a third hamstring injury for him to happen. So he's going to want to warm up his body for at least 10 minutes before his exercises. He's not going to miss the warm-up. He's going to have to warm up anytime he's going to do some sort of exercise. We would like for him to warm up his body, and that's going to constitute of a couple of those hamstring stretches that I just showed. He's going to want to jog instead of run until he can get his hamstring back to full health. Easy calisthenics, nothing that's going to be hard on his leg and hamstring muscle especially. Another thing is going to be stretch and flex exercises for 3 to 5 minutes before and after sporting events. So he's going to have ultimate frisbee game. He's going to want to stretch and flex, because we do not want to see him back in our clinic with another hamstring injury. So what we want him to do is have some time set aside to stretch. And also, as an athlete, he's probably going to have a strength and conditioning program, which is going to be good to help him recover. And the most important thing, eating a well-balanced diet. These are my resources. Thank you very much.